Tonight, we are going to be talking about COVID-19. However, it is from the perspective of each of the professors' areas. And so this isn't what's going on with COVID-19 and Transy, but there will be more of these kinds of panels in the future, and we welcome you to come back for future chats, if you will. There also, if you are curious about what Transy's doing with COVID-19, that has all been publicized and it can be found on the website, and we invite you to look at that if you're curious about things going on. So this evening we have with us that will be speaking in this order. Each of the professors will speak for about 5 minutes on COVID-19 from their perspective, and then we will have time for us to ask questions and learn more. And so this evening we have with us in this order Dr. Paul Duffin, Associate Professor of Biology. Dr. Devine holds a bachelor's from Crinwell College and a doctorate from Northwestern University. His areas of research are molecular microbiology, bacteriology, bacterial pathogenesis, and bacterial genetics. We also have Dr. Meg Upchurch, Professor of Psychology and Director of General Education. Dr. Upchurch holds a bachelor's from Michigan State University and a PhD from the University of Texas at Austin. Her areas of study and research are possible drug treatments for cognitive changes during normal aging, neurodegenerative disorders and drug treatments, and estrogen, selective estrogen receptor modulators, memory, and mood state. We then will have Dr. Bethany Packard, Associate Professor of English and Incoming Program Director. Dr. Packard holds a Bachelor in English and Political Science from Washington University, St. Louis, and a PhD, a master's and PhD in English from Vandy. Her areas of study and research are 16th and 17th century English lit and early modern representations of childhood and cultural reproduction. And Dr. Steve Hess, Assistant Professor of Political Science and Program Director, also serves as a coordinator of Transylvania's Peace Corps Prep Program, and I'm a returned Peace Corps volunteer, so I love that. Dr. Hess holds a bachelor's from Hanover, a master's from U of L, and a PhD from Miami University. His areas of research are authoritarianism, post-communism, protest politics, Chinese politics, and China-African relations. Dr. Ken Slepyan, Professor of History, holds a bachelor's from Williams College, 2 masters, and a PhD from the University of Michigan in history. His areas of research are Soviet and Russian history, modern European history, the Holocaust and war and society. And then pulling up at the end is Dr. Avery Tompkins, Assistant Professor and Diversity Scholar in Sociology. Dr. Tompkins holds a bachelor's in Sociology and Psychology from the University of Wisconsin, a master's and a PhD in Sociology from Syracuse with a CAS certificate in Women's Studies. His areas of research include qualitative methods and ethnography, genders and sexualities, queer studies and theories, sociology of the body and technology, and everyday activism and resistance. And so we're just going to jump right on in, and Dr. Paul Duffin is going to open us up and give us a little COVID-19 from biology perspective.
Well, good evening, everyone. First, I want to welcome everyone to this meeting. What an amazing, robust group of lifelong learners we have in our alumni. And it's one of the things I cherish about teaching at Transy is we all are really lifelong learners. So I'm going to be as brief as I can possibly be, because the most fun part about being a professor is not talking, despite the name professor, but to answer questions. And so my background, as Carol mentioned, is in molecular microbial genetics, and I'm really interested in the mechanisms that pathogens, both viruses and bacteria and yeasts, use to cause disease. Specifically, I'm also interested in how human populations co-evolve with pathogens. Pathogens have been infecting humans as long as humans have been around, and they play a major role in our evolution, and we play a role in their evolution. So in terms of thinking about SARS-CoV-2, which is the actual coronavirus that is the etiologic agent of COVID-19, which is the disease, things that interest me are the way that the virus has moved from other mammals into humans very rapidly. And that process is called zoonosis or zoonotic infections. And we see this a lot in, especially with populations of bats. And I'm sure there may be questions about that. And then I'm also interested in the actual biology of the virus itself and the pathophysiology it causes when it infects someone. So how does it transmit to a person? How does it enter our cells? How does it replicate? How does it exit our cells? How does it get to a new host? And what does that mean for our immune response and any pathology that we might have? It's pretty remarkable in our to think that this virus has infected at least 9 million people worldwide in just a matter of months, and killed 500,000 people worldwide. So that is a pretty remarkable feat for something that is a few nanometers big. And that is a real interest of mine, is how something so small and relatively simple, it only has 11 genes. Humans have about 20,000 genes. So it's pretty simple how that can cause so much damage to our society. And I believe that's within my 5-minute mark.
That is pretty impressive. So you get a sticker. We will next hear from Dr. Meg Upchurch. Dr. Upchurch.
So I'm a behavioral pharmacologist, and a lot of my work has been, as was mentioned in the introduction, related to aging and to neurodegenerative disorders. But I'm also interested in substance use disorders. And my thinking about COVID-19 has related to how does this experience of a pandemic affect people's use of psychoactive drugs? And the drug I'm going to comment on in particular is alcohol. So in general, if you think about what happened during the shutdown, people have certainly lost their jobs. There's been huge social disruption. We don't know what the future is. We don't know what our finances are going to be. And also a lot of the things that kind of stabilize somebody's behavior or provide external controls to their behavior are gone. So people forget what day it is, let alone what hour it is. And if you think about ingesting something like alcohol, that can create pretty large problems potentially. Another factor that has happened is the alcohol delivery or the alcohol supply has gotten a lot easier to access. So people will deliver cocktail mixes to your house if you want, or any other kind of alcohol you want. And there are also more, I guess you'd say, alcohol dealers in a sense. They're people who have lost their jobs as bartenders and are working independently to help provide alcohol to people. So this kind of breakdown in social controls is actually something that you see fairly commonly in substance use disorders. And even though alcohol is, of course, a legal drug, you can see similar factors in illicit drug use. Like you could see very similar kinds of factors relating to the opioid epidemic. So I'm very curious about how we will emerge from this experience, whether people's Instagram posts about their quarantinis are going to provide some peer pressure to other people deciding to try quarantinis also. And also more recent news about individuals going out to bars pretty much as soon as they can and really creating new potential hotspots for the virus. That's another thing of interest to me. I also briefly want to mention what's happening with the illicit drug markets, the opioid markets. So as alcohol has become more available, the supply chains for opiates have actually become less available. And so opioid users have in some cases been put into involuntary withdrawal, and they also have not been able to access rehabilitation services or Narcotics Anonymous or any other kind of substance use anonymous groups. What's being expected here is that as people lose their access to the drugs, they will undergo withdrawal, they'll lose their tolerance, and then when the drugs are available again, they might take the same kinds of doses as they took before, only now those doses are lethal to them. So there's a possibility of a spike in opioid use overdoses at the end of this shutdown. So that's it for me.
Thank you, Dr. Upchurch. Dr. Packard.
All right. I hope I'm successfully unmuted, and I want to echo Paul in thanking everyone for coming and joining us. So as an English professor, a couple of things that I want to highlight. And the first one is just the way that in the absence of community, as we've all been increasingly isolated, the ways in which people have turned to the arts and, for my purposes, to literature to find some sort of community. The ways in which people have started up a lot more book clubs, including the English programs. So let me pause and do a brief plug. We just finished The Overstory by Richard Powers, and we are just about to start tomorrow, Homegoing. And so both reading on your own and reaching out to others to talk about literature as a way that we in the English program are keeping in touch with our colleagues, our current students, alumni, people from across campus. So that has been wonderful. But another way that people have been seeking out sort of a sense of community and using literature to process this situation has really been looking at the literature of periods that have gone through previous pandemics and plagues. So the number of times that I have seen Daniel Defoe's A Journal of the Plague Year referenced lately, it's very good, has really gone up. People want to talk to you about Boccaccio. People want to talk to you about Emily St. John Mandel's Station 11 now. So both things like Mandel, which are fictive, imaginative, thinking throughs of the results of pandemics, and things like Defoe, who's recounting and processing the last major outbreak of the plague. In England, those things are getting a lot more play, and I think it's because people are looking for narratives and looking for models of ways to understand what's happening to us, because it feels so unprecedented. So if you can go and find in the pages of a book while you're by yourself or while you're with your family or your loved ones, these words that other people have used to handle these situations, that's a wonderful thing. And my particular specialty in my areas, as Carol mentioned, 16th and 17th century lit and a lot of drama, and that means Shakespeare. So to finish up, I want to mention the slew of memes and articles about what Shakespeare did during the plague. The number of times there have been tweets about like Shakespeare wrote King Lear during the plague. What are you doing with your life? Or like Shakespeare wrote King Lear during the plague, but he didn't have Netflix. So there are things like that. And there are also, in just about every major outlet, so CNN, New York Times, Atlantic, The New Yorker, on TV and podcasts, people are talking about what was the plague like for Shakespeare. And I have to admit, as a Shakespearean, when we started being locked down, I thought, oh, this is exactly what happened. The number of times that we read things like, oh, well, the theaters were shut down because of plague more than they were open between 1603 and 1613. So like for the bulk of Shakespeare's career, the theater was constantly getting shut down. You had more than 30 people die in London and theaters shut down. Although sometimes they really pushed it closer to 40. They didn't always abide by the quarantine rules. Shakespeare is also someone who survived the plague because it broke out a couple of months after he was born. So a couple of his older siblings died. About a quarter of the population of the town he was born in died. So all the way through his life, there were these shutdowns that regularly endangered his livelihood. So there are lots of people bringing that up, thinking about, well, does this get us closer to what he would have experienced? And also, what does his writing enable us to know? And my favorite thing that I found, and then I'm going to stop, is from Professor Emma Smith of Oxford. And she wrote that one of the things that Shakespeare can give us about the plague, because he did not, like some of his contemporaries, write a play where it's a really huge chunk of the play. So you could find that in Thomas Dekker or Ben Jonson. Shakespeare didn't do that. But the way that he writes about grief and loss is very particular and specific. So one of the things Shakespeare can give us is this idea that this illness actually makes everyone equal, that we all must bow equally before threats to our health, that we're all afraid, and that affects people who are hugely different in much the same way, isn't true. That we all, that when Shakespeare writes about and references plague and other forms of contagious illness, it's always very specific to the individual character, to what's going on in that moment, to that person's social status and where they are in the world, and that is really truer to what we're all experiencing, that the ways COVID is affecting us is not all the same, that health is really very much a social justice issue, and it doesn't make everyone equal. So thank you, and I think I'm done.
Thank you. That was wonderful. And Dr. Steve Hess, you're up next, and looking forward to hearing from you. Thanks.
All right. Thank you, Carol. Thanks to everybody for coming out tonight. I just wanted to talk a little bit about my interest in authoritarian resilience. So my main research area is really about what makes autocracies or non-democratic governments survive for long periods of time. And also with resilience, it's not just how long you survive, it's how you can endure in the face of threat and crisis. And so much of what I end up studying is crisis management, whether it's protests, whether it's natural disasters that can, delegitimize a regime and bring it down. In this case, it could even be an infectious disease outbreak. And so one of the things that's really interesting about how this has hit China is just that it's really revealed some of the, both the strengths and also the weaknesses of this kind of system. So the Chinese system has been very adaptable. China experienced the SARS outbreak in 2003 and put a number of mechanisms in place to make sure that such a thing would not happen again, including a web-based disease reporting system so that, healthcare workers all over the country, if they identified a new unseen disease, that they could put information into that system and it would go straight to the top, and those information channels would help inform a national response that could be effective, where the national government could levy its state capabilities to deal with it. In this case, one of the things that we saw at the beginning was that, this disease was first identified right after Christmas. And one of the things that happened is that, local officials in Wuhan were very quick to inform the national government, that there was, some kind of strange form of pneumonia that had clustered in a hospital, and they had a small number of cases. They didn't know yet if it was human-to-human transmission, but they very quickly, reported upward about that. But one of the kind of mysterious things that happened is that from the beginning of January to about the 20th, the Wuhan government engaged in essentially a cover-up against its own national government. So the Wuhan government, in order to save face, in order to avoid punishment from the top, the local governments eliminated 8 whistleblowers. So there were at least 8 healthcare workers that attempted to talk about human-to-human transmission, and all of them were silenced. There was the destruction of samples of COVID-19 towards the beginning of all this, and there was censorship of the story. And while all that happened, the Wuhan government allowed there to be large numbers. There was a banquet with 40,000 families while human-to-human transmission was going on. There were people moving in and out of the city. And it wasn't until the 20th when the national government got word of this that they actually shut down and used some of these really draconian measures to eliminate the spread of the disease. And so one of the things that's really interesting, or what are the political incentives for officials, to act this way, and what is the nature of the system that sort of encourages officials to limit information to the top, because ultimately, this cover-up resulted in the sacking, of the provincial leaders in Hubei, the party secretary in Wuhan, and the firing of all of the public health leaders in this area. And so, to me, this is very much a question of institutions and politics. Why would you try to cover up instead of reporting upward in this kind of disaster response? And then also one of the things that's kind of just interesting about it is that, when the national government did intervene, we saw almost a complete lockdown across the country, and we saw ramping up of testing, and we've seen the use of, a lot of state surveillance to try to track the outbreak, and even to the point that if you have a mobile phone in China, you're expected to download apps, and you will be identified as green, yellow, or red based on your risk for COVID, and that designation can prevent you from getting onto public transportation or trains or planes, and limit your movement. And even, kind of draconian measures to the point where if you want to leave your apartment complex, you need to have your temperature checked, by somebody who's in your community organization. So, it's just a really interesting illustration of how the system is so strong, but it also has vulnerabilities when it comes to information moving from the bottom to the top and allowing the system to really adapt and to respond. So to me, in a lot of ways, this is just a very tragic kind of political question. And we've seen, different responses in different countries, democratic or non-democratic, all the way from New Zealand, where there's, where they had 0 cases after a state response, to, where the United States and Brazil and other countries are seeing just massive outbreaks right now. So to me, COVID-19 is really just an important test of different political institutions and political systems, and then also just political leadership and decision-making at the top. All right, thank you.
Thank you. Dr. Slepyan?
Okay. Thank you, everybody, for coming and spending your time with us. So as an historian, I probably am not really ready to talk about COVID-19, so if you want to get back to me in about 20 to 50 years, I'll be ready to go. But from an historian standpoint, we can look at disease in any number of different ways. And I'd just like to very quickly point to 3 different ways we might think about, as an historian might think about COVID-19. And the first would be to think about it in terms of broader demographic impact, and to think about this in terms of other diseases, other pandemics that have swept humankind over the past centuries. So in thinking about COVID-19 comparatively, we might look at the Black Death in the mid-14th century, which wiped out about 1/3 of the European population. We might think about the smallpox that was unleashed on Native American communities with the arrival of Europeans, and what impact that had. And we would also, of course, what a lot of people have done have looked at the 1918 influenza, because that's been the last great world pandemic that has struck. And not to play a numbers game, but again, people have, or epidemiologists, medical historians have estimated that somewhere between 20 to 50 million people died of the 1918 influenza. And so this helps us understand COVID in a more broader world historical impact. And of course, the pandemic is by no means done with us yet, but it's one way to be thinking about this in comparative terms. A second way that historians might look at COVID is to look at other societies under the impact of disease, and how has disease affected, societies, their social structures, values. How has disease been presented? So, for example, in the Middle Ages, during the Black Death, Jews were accused of bringing the Black Death by poisoning wells. And that led to a series of pogroms against Jewish populations throughout Europe. So we might be thinking about what would be the social impact of disease, or again, to go back to the Black Death, to look at the way the loss of human life, how that affected social relations in the years following that. So that might be something that we would be looking at in the past with an eye towards what might be taking place in the present. I'll be touching on that in just a second. We also could see behaviors that we might not expect to see. So for example, skepticism about medical professionals and what they knew, and did they have a plot up their sleeves that they were trying to impose on us? Or skepticism about masks. So during the 1918 pandemic, there actually was in San Francisco an anti-mask league, which chartered and formed an organization to protest against the wearing of masks. So we can see again suspicion in the past towards medical practitioners and what stresses the disease reveals. And so if we think about that, then we turn my third point would be, then how can we apply thinking about things historically? Are there lessons that we might learn in the present that we might want to think about with regards to COVID? So I'm sure that many of you have already seen the graph of Philadelphia and St. Louis in terms of social distancing. And that was used quite early on in the pandemic here to explain the need for lockdowns and to say we really want to be like St. Louis and try and flatten the curve. And so that was an attempt to use historical analogy in order to help us to behave in a particular way in the United States during this time. So that was a lesson which we learned or did not learn, and I think some parts of the country have applied it well, and others perhaps not so much. Another thing to think about is to reference back to what I said before about the Black Death and how that was used to stigmatize a marginalized population. If we think about that with regards to COVID, what happens if we start attaching names to the disease, and what happens to marginalized populations in the attachment of that disease? So if COVID-19, its medical name, and that's the name that is being applied to modern day terminology, if it starts becoming known as the Kung flu, what does that mean then in terms of marginalized populations, Asian populations, which might then become stigmatized by this? What is going to be the impact of that? Well, history gives us a lesson on this, and that might be something that we might also want to pay attention to about the consequences of these kinds of things. And so with that, I will mute myself and look forward to the rest of the presentations.
Thank you so much. Dr. Tompkins, you're up.
Hi, like others have said, welcome, and I want to give a special shout out to my former students, many of whom are here. So some of whom I can see and some I can't. So I'm a sociologist, and sociologists really have a lot to say about the pandemic. So this past semester, I found myself teaching medical sociology, which for my colleagues, we plan our classes, the previous February or March is when we choose them. So you know, January 7th rolled around and I'm casually talking about pandemics on the first day of class. And a few weeks later, I'm like, okay, we're now having a class in a pandemic. And it slowly just kind of got worse as the semester went on. Some of the things that we talked about in that class that were very important back in January, February, March, but we are seeing even greater importance now are things like health disparities for various populations, particularly in the US. So for example, we already know that folks of color, particularly Black and Indigenous populations, face health disparities in general, right? So greater lack of access to care, lack of access to insurance, and lack of access to quality care. So getting care is not the same as good care. So the pandemic has definitely exacerbated some of these disparities. We can see that in some of the statistics we have around infection rates for certain populations, lower income populations, Black and Latinx and Indigenous populations, for example, both around testing, but also the reasons for why the infection rates might be higher. Part of this is due to white supremacy and structural racism, right? So when people have historically not been granted access to something, that gets exacerbated in a crisis situation like a pandemic. And so that's something we definitely talked about in my class last semester. One of the other issues that came up is really just, I think, I'm not sure who mentioned this. I'm not sure, since maybe multiple people mentioned this before me, but just the general fact that globalization and the technology that humans have invented are what creates a pandemic. like Paul said, it's a zoonotic virus, right? But if we weren't able to move around, it would be fairly localized. It would not be able to spread in the way that we see it spreading now, right? So things like cars, right? Trains, boats in the past, right? But now air travel have allowed the virus to spread at much greater rates, and it can spread faster than people can rein it in. And so when we look at things like technologies that have been invented that are all really great technologies, these things have also fueled the virus and have had it sort of be exacerbated in a way that it's not that it, you know, previous pandemics weren't a big thing, but our global society is something that the virus has definitely been a fan of, for sure. The last thing I want to mention, and Carol mentioned this at the beginning, one of my specialty areas looks at gender, and I teach classes that look at gender. Some of you may have seen some of the interesting articles and studies that have been done that talk about the more a person adheres to traditional norms of masculinity, the less likely they are to support wearing masks. And this is something that, as a gender scholar, is so interesting to me and so not surprising at the same time. So when we look at men and health in particular, we know that men are less likely to access health care unless that care is something that's like a crisis situation, an emergency, or if somebody else is pushing them to receive care. So a partner or spouse, for example, or a family member is really pushing them to receive care. Part of the reason for that is that many men, particularly those who adhere to more traditional gender norms around masculinity, feel that accessing healthcare makes them weak, and that to refrain from receiving care makes them a strong person, right? Like men can tough it out, like just get back on the field, like that knee will be fine, you know? But the thing that's happening now is that while someone's knee on the field is really a personal problem, wearing a mask is everybody's problem, right? So that one's own views about something like masculinity or how receiving healthcare or caring about your health is a marker of strength or weakness, that adhering to those things is really something that's affecting everyone, right? It's no longer a decision that only affects that person. And I think that that speaks to a larger issue in our society around gender norms and what it means to be a masculine person. Does not wearing a mask and potentially putting other people at risk equal masculinity, or does wearing a mask and protecting people in society equate to masculinity? And I think that that's really something that folks definitely in the US are really hopefully going to think about, but we'll see. So I'm happy to talk about any of that more if people have questions.
Thank you so much. That is all of that was, I took notes, and there, we've already received a few questions, but again, if you want to try to get a question in, please use the chat feature. And I'm going to start with some that we received in advance. What connections do you see between global responses to the pandemic and other global crises like climate change? And I'm going to let you all, any of you, holler about that.
I'll jump in here.
Awesome.
I think in some ways you can draw some parallels, but also you can draw some pretty big distinctions. One thing with climate change, as you all know, it's slow and progressive and is easily denied, even in the face of overwhelming and rigorous evidence. I think that is in somewhat difference to the current situation because of the rapidity of what's happening. This is happening, I mean, right in January, there were no cases in the US. And here we are in June in our current situation. So I think there are some parallels in terms of the, as Ken mentioned earlier, this loss of confidence in science and a loss of confidence in experts. And that's been something that's been growing, at least from my perspective, in this country for quite some time. You know, vaccine deniers would be included in there. You know, that is a pretty important movement in the last few decades, and climate science deniers. And so I think the parallels you could draw are that it is a huge cost to governments and societies to deal with these problems. And so a lot of times leaders may not want to expend those costs because of economic reasons or other political reasons. But at the same time, good leaders, I think, are able to rally people around the idea of problems that need to be fixed that are larger than perhaps their single government. And maybe Steve could talk a little bit about how governments interact globally with that. So I see some parallels and also some differences. I also want to just say, I was taking notes while everybody was talking, that I think it was Avery that said, you know, technology has played a big role in the speed of these sorts of diseases spreading, and that there's a great couple of sets of articles in, I think, Scientific American that discuss why we're seeing these zoonotic diseases from bats. And the one word answer is, we're in their habitat, destroying their forests. And so there are consequences to that. So I'll let others jump in at that point right here.
Yeah, do any of the others of you want to jump in on that? Dr. Hess?
Yeah, one kind of just big, clear connection or parallel between the two would be that they're both global collective action problems. These are all, climate change and, global pandemics are both things that require cooperation between different nation state actors. You can't solve them by yourselves. You have to work with other actors. You can't, completely prioritize your own national interests. Sometimes you have to, take a deal that benefits a rival country, an adversarial country, a different country, and it benefits them more than yourself. And so you have to kind of put the greater good above, above the national interest. But we live in a world that is defined by nation states, that are competitive with one another. And, these states are, the prerogative is to serve your constituencies, to stay in power, to get reelection. And the only people that determine that are your own national constituents. And so it makes it very difficult for, countries to deal with these problems, even though they are interdependent. Your economy cannot thrive unless the global economy is thriving. Your national population cannot be safe, unless the world is safe from these kinds of things. So global collective action is a very difficult problem. And those are the kinds of problems that are becoming more and more, just viscerally in our face that we have to deal with. And we are currently not well equipped to deal with those things.
I'll keep this quick. Just to kind of piggyback on what Steve said, that historically in the post-World War II era, the world has been used to American leadership on these kind of global crises. And I think to make that connection to climate change and to this, we are seeing a transformation where the United States is no longer playing that role. And this is not just one administration. This is taking place over multiple administrations, particularly if we look at this over in terms of climate change. But it's part of an historical process. And we can leave this open to debate as to whether or not this is taking place. But I think we can look at COVID-19, we can look at climate change and responses to it, and think about this. What does this mean in terms of decades-long ideas of the international order and the United States' role in that? And so this would, I think, be a part of that.
Yeah, definitely. That's a really great point. I wanted to turn the table just a little bit, because all of us are living in such heavy news with daily counts and whatnot. I would love to know from any of your perspectives. We got a little from Dr. Packard, some good news about maybe some creativity that could come out of this. But what is some good news out of this? What are some positive things that we are seeing, or that we might look to in the future, or maybe learning from history, or your own perspective? But do any of you have anything to say about that? Good news. Bring us the good news.
Okay. So I think one of the things that we've seen is families have been forced to reconnect in some ways. And not only has this happened with in-person families, but there's been a huge rise in video conferences such as this. And that's allowed long distance connections in families, as well as new kinds of social structures developing. So I think that will come out, there'll be a benefit.
I've got a couple. Every other species besides humans seems to be benefiting from COVID-19. We're seeing dolphins in the canals of Venice, and we're seeing the first sort of slowdown in climate destruction that we've seen in a while. So it's a silver lining, right? Another thing is just we've seen, a lot of cases of heroism amidst the pandemic, whether it's, and whether it's healthcare workers in China. If you're asking how did the national government find out, it was a whistleblower, basically, a Shenzhen-based doctor who who reported the human transmission in a faraway province, and then you also had examples of people who were trying to report the truth, and were silenced by their own government. But both in China, we saw a rush of healthcare workers that went to Wuhan. Over 40,000 that came to help. The same thing was repeated in our system. So when Governor Cuomo had made a call for healthcare workers, a similar number, about 40,000, came from across the country, and some ended up contracting the disease and dying. But it's like what Fred Rogers said. Look for the helpers.
I'll jump in with a couple. One that's maybe in my area of specialty and one that is not. And I'd say these are hopes. I think time will tell. I think one big hope, at least in the United States, is a shift in the public's perspective of the importance of low-wage workers and service workers. And I certainly hope that we start to value that everyone should earn a living wage, and that we should support people, and that when people are living this close to the margin and something goes bad, they really suffer. So that's a hope. Now, that's not anything with my specialty. I think another hope that I have that is more in my specialty is a return to confidence in science and experts. I don't know whether that's going to happen, but I certainly think that having a robust discussion of experts about the best course of action at the local level, at the state level, we've seen some really great leadership of some governors and some administrations that have taken the lead. And so I hope that, when a vaccine is developed, and I have a couple of private chats that I may want to address that to the group here in a minute. But once that's developed and we see the triumph that is public health and science, and that no one will get this disease ever again if we have good vaccination strategies, that's an amazing triumph of science. And so I hope we can return to trusting science to improve our lives.
And as a pastor and a preacher, I just want you to know I've heard quite a few sermons that have lifted up science. So maybe there is great hope in that. Do we have any idea about the long-term impact of COVID on survivors, long-term effects on lungs, potential for future strokes, etc.?
I'm going to assume that's probably to me.
I'm guessing so.
So looks like Trevor Martin sent that. We don't know. We can look at other coronaviruses and their long-term impacts, and probably the closest one that we can look at is the SARS coronavirus that was in the early 2000s. And interestingly, the SARS coronavirus and this coronavirus have 80% identity at the genetic level. So they're really similar viruses. What was different in that case is that virus kind of died out. It kind of plateaued, and then cases decreased. And we don't really know why that's not happening here. And it also appears that this coronavirus is much more infectious. So that's just some things we can kind of compare and contrast. That is definitely an active area of research. I think time will tell. Anytime you have somebody that has a severe acute respiratory syndrome, there is almost certainly going to be long-term pathologies and effects of that. And so another little wrinkle here is we don't yet understand why some people get really sick and maybe die, and some people don't even know they have it. And that there are some other viruses that have that range of symptoms. But the real answer, Trevor, is that we just don't know. I would, again, predict if you had a very severe case and were hospitalized on a ventilator, you're going to probably have some long-term effects, but what those are, we don't know.
Thank you. And for all of you, again, Transy's plan for coming back and dealing with things is on the website. And so we would invite you to learn more about Transy's very in-depth plan on their website. So Dr. Tompkins, I wanted to ask there has been a lot of discussion about whether or not we would be getting the attention to racism if we were not in a pandemic. And have you read, thought, or have some thoughts to share with us about that?
Do you mean, so if we weren't in a pandemic, would
the changes that we're seeing be happening? Would we be having the level of protests and seeing some positive changes in policies and that kind of thing? Do you think that the pandemic has had an impact on that?
I don't know if the pandemic has had an impact on the protests as protests. I will say that law enforcement killing Black folks has nothing to do with the pandemic. So
yes, that is true.
Right.
But that's been going on for quite a while. So there's a tension now.
That definitely has happened before. There's a history of it happening. I think for whatever reason now, people have felt that now is the time to protest in a way that we haven't seen since the beginning of the Black Lives Matter movement. And so that sort of passion that came up a few to several years ago has now returned, obviously. But I mean, in my opinion, I don't think that it really has anything to do with the pandemic. I think people are angry, and rightfully so, and they should be protesting. Like they should be. So yeah,
do any of the others of you have a word on this or thought
so
on
it is well outside my area of expertise, very, very much so. But it is something that I have been giving a great deal of personal consideration to. And the thing of, there are a lot more white people protesting right now than there were, say, even after the I'm going to say murder of Mike Brown.
Yeah.
And that question of, well, why? I feel like I've seen that question. Well, why now, white people? A fair bit. And so I have no expertise with which to answer this question, as Avery does. But I wonder if, and others have brought up this question of American individualism versus collective action. And I wonder if, as we have been, some people at least have been attempting to strengthen our community building muscles and our empathy muscles in these times of isolation, if for some people, engaging in some kind of collective thing, I am going to wear a mask and stay home to help other people, and or if the process of experiencing a lot of anxiety and a lot of fear that you, if you happen to come from a more secure background, if going through those things might have made some people more willing to put themselves on the line. And I have no idea if that is true, but it is something I've been thinking about a lot lately.
Yes, I have too. I've just wondered somewhat. Yes, thank you, Ken, please.
Okay, so this goes actually back to my rather weak joke at the beginning of my presentation about ask me in 20 to 50 years. But one of the things that we might be seeing is a coming together of a lot of social tensions that have been generating for a very long time. And the pandemic is the spark that breaks everything open. So this is a theory. This is by no means a hard and fast proclamation or anything. But there have been, and this is not original to me, this is things I've read, that we can think about this perhaps, possibly in the social change that's taking place as comparable to what took place in France in 1789. That is, you had a series of crises that were developing about governance, about the nature of society, about social misery, and all of those things came to a head. And the French Revolution in the first few years was just basically a series of events and mass actions that sometimes didn't seem to be at all coordinated. They weren't like the American Revolution in that way. And so some people have speculated, some historians have speculated, that what we could be seeing is the opening of a great social transformation that COVID has helped bring about because of the acute tension and crisis that is put around all of society. We don't know. It's way too early to tell. But that might be, if you want to take the long view, that might be another way of thinking about this.
Yes, thank you. Dr. Hess, how do you think the virus will impact the election? We are already seeing the virus as a political tool. Interested in your opinions.
So if you've been looking at, opinion polling over the last month or so, you see that, Joe Biden has a widening lead over Trump. It's usually it's become normal for it to be 10 to 14 points, nationally. Of course, it's 4 months away, from the election, so almost anything could change. Michael Dukakis had an impressive lead at this point in his attempt at the presidency, but President Trump has not done well. He's majority disapproval for his response to COVID, so it has hurt him in that way. Also, we're seeing the biggest resurgence right now in some very critical electoral states, Arizona, Florida, and even Texas. Is Texas in play? That has been the question for the last couple cycles. Probably not, but maybe. The other thing to think about is how the virus will change actual elections. So, Kentucky had a lot of had a lot of sloppy journalism about voter suppression heading into this primary election. And now they're talking about a Kentucky model of holding an election during COVID. So, where it's focused on mail-in and, no excuse, absentee voting and no excuse early voting. Hopefully they have a few more election sites, at least in the big cities. There'll be a lot of controversy about how the election itself is conducted. So there's a lot of allegations about voter fraud on one side and voter suppression on the other. We had, even the president that won the election was questioning, how much voter fraud had caused him to lose the popular vote. So there's a lot of concerns just about however the election goes down, that there's going to be a lot of allegations that, the way it was conducted produced one result or the other. So the other thing to think about too is we are an extremely polarized society. So there's even, President Trump's really low approvals right now. It could be a lot of Republicans that are waiting to come home, like they did after the Access Hollywood tape in the last election. So you can always almost always bank on a close presidential election in the fall, even in, really unusual circumstances.
Thank you. I'm going to ask one more question, and it's to you, Paul, and it's kind of combined so you can answer it however you want. I have a question about the vaccine development in the next 12 to 18 months, and also a question for you comparing and contrasting typical flus each year versus this. So however you want to weave those together.
I will do my very best. So let's talk a little bit about vaccine development. So vaccine development does not follow a linear progression of first do A, then do B, then if B works, then do C. It just doesn't work that way. And so up until now, the fastest time a vaccine has been developed and out to the public was between 3 and 5 years. That's the speediest we've ever done it. So that sounds pretty bad, but let me maybe make it sound less bad. There are currently, I counted this morning, 90 different vaccines in clinical trials currently. So there is an enormous global push for a vaccine. And I think that can give us some hope. Additionally, there have been some new technologies in the last few years that may really help speed things along. I do want to have some caution that to make sure that we don't rush an unsafe, untested vaccine out to the public, which I think would could harm people and further damage the science and vaccination. So there's a little bit of a tension there of ensuring that what you're giving out to the public is really going to be worthwhile and effective. Weaving in that into the seasonal flu, many people don't realize that seasonal, regular, every year flu in the United States kills between 10 and 30,000 Americans every year, which again sounds really bad. Now, the differences here are that that's over a pretty long period of time, that's over the year, and that flu, regular seasonal flu, tends to affect the very old and the very young and folks who have what we call comorbidities, who have an underlying condition, emphysema or heart disease. And so they really are apples and oranges as far as the way they spread and as far as the damage they're doing. We also, seasonal flu, we have pretty effective vaccines every year. And so while it kills a lot of people, it's also relatively preventable. And flu vaccines vary in their efficacy year to year. Generally, the efficacy or how well the vaccine works or protects you is usually in the 60 to 85% range. So you can think of that as a 2/3 to over 3/4 less chance that you will get the flu. That's kind of one way to think about those numbers. And so they really are pretty different diseases. They spread in somewhat similar ways, but they really affect people differently. For most people, seasonal flu is awful, but not deadly. And again, I think a big difference is we have good vaccines for the flu. I don't know if that's a deep enough answer for what you're going with, but I'd be happy to answer any follow-ups to that.
I think that is perfect. I appreciate very much. I just would encourage all of you who we can see, or if you want to turn your video on, if you will give a little praise to our speakers with your hands in some way. We give great thanks for you all. This was just fantastic. And thanks so much to Natasha and everyone who made this happen. The alumni have been asking for something like this, and so it was really quite a treat. If you see in the chat, there is an email address, alumni@transy.edu. If you have any questions that I didn't get around to or something else comes to you, we'll be happy to follow up and get those answers for you. Also, that there's going to be a series of Zoom events on various topics coming up, so stay tuned and pay attention to that. And then I also wanted to, Brian Lewis asked me to tell all of you in his masculinity that all of you please wear a mask when you come to campus, and that we want to see everybody in masks. So it has just been my pleasure to be with all of you. It's beautiful to see many faces and names that I know, and then some that I don't, and give great thanks for you all and for you being here this evening, and we hope you have a beautiful evening and moving on into the weekend, whatever that means for you. Gorgeous evening. Thank you all so much.